the research is a major part of what we do. AI is actually making a major difference in the way we operate as well as the fight against cancer. So I believe that AI is a real differentiator in healthcare. The other things that we paid attention to is that when AI doesn't really know the answer, don't generate an answer. Test in China where there's a hospital that the only doctors are AI. We do not recommend it at this point. We are far away from that.
Welcome to Sierra Ventures CXO Insights on AI, where we will hear from top technology executives from Fortune 500 and leading global enterprises. My name is Mark Fernandes. I'm a partner here at Sierra. Our guest today is Tsvi Gal, Chief Technology Officer at Memorial Sloan Kettering, one of the oldest and largest cancer centers in the world. Welcome, Tsvi.
Thank you very much, Mark.
Tsvi, could you give us a little color on MSK and kind of your organization there?
Sure. So Memorial Sloan Kettering Cancer Center does only one thing. It is in the name. Basically, our main goal is to fight cancer and eliminate it. As such, we are divided into what we call 2.5 parts. We have the hospital itself, where the treatments, administration, and everything else is part of. And then we have also, which is about 20-some thousand people, we have also the research arm, Sloan Kettering Institute, another several thousand people. And then we have the university, which we run jointly with Weill Cornell and Rockefeller University. So it is, as Mark suggested, it is one of the oldest, actually it is the oldest cancer center in the US and one of the oldest in the world. It was established in 1880. And one of the things that is unique about MSK is that we keep the records of every patient that ever visited us. So we can tell you that in April 1st, 1880, the name of the first patient was Karen. We have her records. We know exactly what she had. And this is important to understand the trends of how cancer evolves over the years. So that's basically it. It is our headquarters in New York. We are mostly a northeastern environment as such. And as I mentioned, research is a major part of what we do. And later on, we're going to go into more details, but AI is actually making a major difference in the way we operate as well as the fight against cancer.
And Tsvi, what about your organization within MSK?
Oh, okay. So yeah, I'm my organization basically, well, let's talk about the technology organization. The overall technology organization supports all the 3 arms that I mentioned before. And by the nature of its being so, there is a lot of investment that we are doing in the research side with high performance computing, with basically a lot of the research that is done there is a major part of it. The rest of it is a traditional IT organization with a lot of work in the cloud, a lot of work with automation, AI ops, and so on and so forth. So altogether, the IT organization, if you include IT plus informatics, etc., is a little shy of 2,000 or so. It's a little smaller than that.
Great, thank you. So where are you in your AI journey, Tsvi? Could you give us some specific examples of things that have really helped you and maybe some places where it hasn't yet worked?
So AI for us is a long-term thing that we do. Now, we started many years ago before AI became so popular. So before Gen AI and before all of those things. So mostly it was what we call today traditional AI, machine learning, deep learning, neural networks, all of the above, used mostly at the time in the research environment, and later on expanded into other areas as such. So I'll give several examples across the board. I'll start with the front office. About 5+ years ago, we decided to outsource our level 1 support. But rather than outsource it to a vendor, we decided to outsource it to a conversational AI. At the time, the average wait time was about 42 minutes, and the abandon rate was about 27.5%. Today, our wait time is less than 1 minute. We have virtually no abandon rate, and our cost went down by about 35%. So that was just one example of where AI can really help. Now, this started, of course, as conversational AI, which was before Gen AI existed. After the LLM's revolution it came about, we now upgraded the system to actually provide more of a conversational, AI plus the Gen AI part of it. So it is now expands to way more cases. When we started with 15 use cases, and for the first several weeks, we basically, knowing that people may be hesitant to use an AI system, we gave them an option to say, if you don't want to use AI, just say human, and you will be able to talk to a person. Not surprising, in the first few weeks, about 82% of the people decided they want to talk to a human person. But what happened while they were waiting, we let them know that they will not use the place in the queue, but since you have to wait about 40 some minutes, why won't you try the AI version and see how you like it? And they also noticed that people that were using the AI version actually did not wait so long. So within about less than 2 months, it went down from 82% to 12% that chose human as their first choice. And right now it's much lower than that. It's in the single digits, lower single digits, mainly because of two things. People got used to work with AI. Plus, we expanded the use cases to address many of the other areas. The other things that we paid attention to is that when AI doesn't really know the answer, don't generate an answer. Just say, okay, I need a human being, and then move it to an expert, which are level 2 support and so on, to get the response, which was very important because the last thing we want is to start spinning around with this. So that's just one example in the front office, and then due to time, I will go very quickly just a few other examples. But today we use so what we call ambience. There is an ability for us to record the conversation between a doctor and a patient. In the past, post every conversation of such, the doctor had to write a summary. My mother was a doctor, so I can tell you right away that she did it in a totally ineligible handwriting. Nobody could read it besides her sister, which was a pharmacist and made a career out of it. But seriously, today, basically, the system records the conversation, summarizes it for the doctor, adds the right codes that come with this. And there is a version for the doctor, which includes the medical terms, etc., and a version for the patient, which is in plain English, because otherwise they will not understand it. And that's where we see this going and expanding from that perspective moving forward. In the research side, as I mentioned, AI has been embedded in our research in all over the area. We have high performance computing for many years, and it's at the time it was one of the largest in the nation before Gen AI created a new demand, and now we are much smaller, relatively speaking. But it is a major part of what we do. And the research that today we have about 160 labs, and 70% of them today are using AI as the main or as a complementary tool to provide the research. And the research there goes everything from anomaly detection to understanding images to develop new modules and understanding of genomic sequencing, all the way to the creation of new drugs that are helping our patients. And the new drug discovery is really revolutionary in this sense, because and the ability to really mimic the genomics of a mouse into the computer to create basically a simulation or a digital twin of such enabled us to really test some theories on the electronic version before we actually go to real mice and then real people, which cut huge amount of time measured in years as part of the research. One of the examples that we used at the time was that there was a study of people that had rectal cancer, and after the treatment that was created, which was immunotherapy type of treatment, that we achieved a very unique situation where 100% of the people that were in the test got 100% remission. So Of course, we tried to not emphasize it because things can happen. It was a limited study, but it shows the power of AI in terms of its ability to expand and faster our learning and our ability to achieve our goal, which is eradicate our cancer for life.
We've invested in radiology AI companies, as you're aware, right?
Yes.
Do you see this as a transition? How fast is this transition? Are we setting the right expectations in terms of how AI is going to impact in the near term and midterm here?
It's a combination. So it depends on the area. So for example, in radiology, we think that AI is not going to be a replacement for the radiologist as much as a force multiplier. In other words, enable radiologists that look at certain amount of images in a given day to be able to do way more than that by basically identifying anomalies and pointing things that the AI could identify clearly, and then for the exceptions and decisions, etc., radiologists or the human in the middle needs to be involved. But that's just an example. Overall, there is clearly an irrational exuberance in terms of the expectations of what AI can do today. And you have basically the two camps, one which is kind of anti-AI. We think it's terrible, it's going to make all of our jobs go away and it's the end of the world. And all the way to the other extreme, in which basically are saying the same. AI will take over the world and will make a huge change, but it doesn't not necessarily a bad one, because there could be a lot of opportunities to improve humans' life altogether around the world if we can actually attack it this way. So it is a mixed bag. I think that the reality is, of course, as always, lies somewhere in between. We are still far away from AGI, so kind of general purpose AI, and but the progress that has been achieved in the last few years is immense, and it is most notable in the healthcare environment where a lot of data needs to be crunched. A lot of forms and other things that are repeatable can be processed. So I believe that AI is a real differentiator in healthcare in a big way. Probably not the same as fast as people think that in the next 3 weeks it will disappear. We read some comments, and there is a test in China where there's a hospital that the only doctors are AI. We do not recommend it at this point. We are far away from that. But again, big progress, and again, it could really make a difference in terms of the quality of life and longevity of our patients, because it will allow us to identify root cause earlier, and also via personalized medicine to enable our patients to receive the treatment that is right for their genome, not just generally to the symptoms, but for their specific genome, what is the right treatment, and that makes a hell of a difference.
When your life is on the line, I think a little more empathy would be very valuable. So,
absolutely.
Tsvi, as you look at your organization, what's been harder than expected? Technology, the data, or just the organizational change?
Well, I think it's a combination of all the three. I mean, the technology is not as mature as people could think. While there has been a lot of progress in terms of reducing the amount of hallucination with RAG and some other mechanisms, and as well as with closed loops where you look only at your data and so on and so forth, it's still not 100% reliable in all times. And when we come to people's life, you cannot play with it. It has to be reliable 100% of the time. You cannot say, well, I tried. It doesn't work like that. So that's very important from that perspective. So the technology is getting there very quickly, but it's still some place to go from that perspective. Clearly, the organization and the people which come together are a major part of it, because everybody that looks at ChatGPT, or either the OpenAI one or the other versions that comes with Gemini and whatever, after they play a little bit with prompts, they think that they now know how to rule the world, and the problem is that that's not always the case. So there is a pushback from some people that, as I said, really don't want AI to intervene because they are afraid of their jobs and so on and so forth, as well as the organization itself is built and designed based on the pre-AI world, when everybody was human and not necessarily understanding that AI agents today could be part of your organization. You just need to understand their role, their limitations, and what they can do, but you need to count them as part of the organization. They're not a side of the organization or just a tool. They could be part of the organization itself with specific roles, specific expectations, and specific limitations. So all of the above is basically work in progress. But again, I would also give us, and I mean us, the industry, a little bit of slack, because it is very new. Okay, it takes time to adjust. But I think that companies need to be aware of what they're doing and also not exaggerate with their expectations and abilities. And there are several dangers that come with the, as I said, with the exuberance of AI, such as, for example, the fact that many organizations stopped hiring students, graduates from colleges because AI can do this all together. That's very short-sighted. And I think there is a place for humans in the future, but and I think that those companies eventually will regret those decisions.
That's very valuable advice, Tsvi. And I want to come back to, college graduates as our last question. But what advice would you give to startups, actually, right? I mean, we're in the venture capital business.
Of course.
You're building, buying, partnering. We measure things in days and weeks now, as opposed to months and years. So what advice would you give to startups, selling into organizations like MSK?
So there's always the debate between a set of tools that can resolve one problem all the way deep, and ones that could go kind of more horizontally and do many of those things. In other words, should you create a solutions that can do many things, and some of them better, some of them less, or you just do one thing and you do it extremely well? That's also the way we think about the difference between large language models and small language models. People forget that small language models are still very valuable if you focus them on certain areas. So I think that the bottom line is that for startups, when they come to resolve issues in healthcare, and by the way, in every industry, the first advice would be, before you come and tell your client what the problems are, you may want to ask the clients what the problems are. Because many times startups, etc., call and say, we know exactly your problem and we know how to solve it. Do you really? Of course you do. You may not know your problems, but we know your problems. So there's a little bit of arrogance in this approach and doesn't work so well. But if you understand, if you listen, if you understand where the real issues are, and you can actually make a difference, then this is a great opportunity today for startups, because the world is still not dominated by very few major vendors that control the world. There is an opportunity, in a way, a renaissance for many companies to provide their solutions that could be useful from that perspective. My other advice would be, so again, from a technical perspective, I would say, understand your client really. Spend time with several potential clients, understand where the real issues are, and try to create a solution that could support several of them and not just one of them on one hand, but also focus. Don't try to solve everything. The idea is that I created have an agentic AI and I now have agents and I can do any work in the world. Yes, maybe if you are a gigantic companies that can do everything, but even them, they don't. So focus on few areas, be very good at them, and show the ROI. In other words, there must be an outcome that is measurable for the client. And it could be, for us, it's not just money. It's not just, we save money, etc., or we make more money. For us, ROI could be, longevity of people, faster time to develop drugs, quality of life. There are a lot of parameters that could come into play, but they're extremely critical for any startup's proposition to be attractive. But it is a good time for startups because, as I said, remember the old days. If you can't go wrong if you buy IBM. We don't have this in the AI world today. Even with the giants, with clearly the OpenAI and the others, there's still a room for startups.
So one last question on the AI piece of it. What part of the stack would you redesign if you knew AI was coming? What would you do? What would you have done differently?
Oh, that's a very good question and very hard to answer because AI touches almost everything. And that's really the amazing part of it. I would say that if I separate the clinical side and the research side from the more IT operational side, I think there is the way we look at automation and what you may call today AI ops is mostly after the fact and not ahead of fact. Which by this I mean what we're trying to do now is create solution to resolve problems that we created. If, in retrospective, if we had, let's say, AI several years ago and we knew that we knew it was coming, our entire approach to automation would have been different. It would be really end-to-end with the full understanding of the picture, with the knowledge that comes with the generative AI environment, as well as the ability to read huge amounts of data so quickly. We would have redesigned our entire infrastructure structure altogether. That's just in this area. And I can do the same with the clinical and research, but respect for time, maybe not.
No, that's very helpful. And so maybe go back to that question. You guys are associated with one of the top universities in the world. My daughter's at Carnegie Mellon. What advice do you give college graduates right now? Everybody's laying off, very few new jobs. How should a college graduate be thinking about this, besides going and starting their own company?
Well, that's one of the advices. Besides the other one that I actually heard from someone, which was an annoying answer, which is learn plumbing, which is I don't think is the only solution. I think that the advice would be it depends on where you see yourself going in terms of what you want to do, because when you look at AI, there's different layers. There is the people that actually build AI, which is a different type of skills from people that really use AI, and so on and so forth. To build AI, we're talking about, besides Bayesian statistics and understanding of how vectors go and all of those things, it's a very specific skill set that very few people will actually possess over time. Using AI effectively is very important. So, for example, if you learn computer science and you like to code, etc., don't fight it. Go with it. In other words, you already use GitHub. Okay, that's probably natural for you. Fine, use Claude as well. I mean, don't think that you're superior to that. Use it as a tool, but it is a tool. Don't forget, it is a tool. In other words, the design needs to come from you. There are several things that those tools cannot do. If you can provide these capabilities, that you are a really fantastic user of AI capabilities and tools as they are, and you can still add value, then even in today's tight markets, then there will be people that will be happy to hire you and give you the opportunity. That will be the advice from that perspective. And other than that, I think that there are several companies that will understand that it is in their best interest to take smart people off college and then train them to be, to use the toolings that they have and lead the world rather than rely solely on the tools themselves. Because at the end of the day, generative AI, the name is right, but what it still misses is ingenuity and innovation. And that's something that still could come from humans. Even within the tech world, there's definitely a lot of hope for this. And as an example, we decided to continue with bringing in our young talent and give them opportunities because we believe that in the long run, it will be in our favor and not a waste of time or money.
Oh, there's still hope for us. We're problem solvers. So thank you very much. We really appreciate your insights.
Very much. I appreciate the opportunity. Thanks, Mark. Bye-bye.